have that information for us as an individual, but to be able to share that information with others. We do have the Census 2020 that is here. Susan, if you want to wave your hand back there. How many of you have heard that the census is coming this year? Raise your hand. Okay, great. The census is very, very important because it determines how much money comes into a community. So if you are able to fill out that census form, we want to make sure that you do that. It is very critical and important that you do that. Susan Prater also has jobs. Somebody say jobs. Say it better than that, jobs. She has some jobs. She has some job openings. So if you're looking for a job or know someone who's looking for a job, make sure you stop at the census table. We also have the Center for Holistic Development that is here, and we want to make sure that you stop by their table. They have some mental, behavioral health information that they can assist you with, some other programs that they have, so be sure to stop by their table next to the census. We also have the Live Fearless, which is with Blue Cross and Blue Shield. Wave your hand. This is their first time here, so welcome. They have information about insurance, their wellness programs, a number of things that they're offering, not only just their employees, but to the whole entire community. So if you're interested and you're on that journey of health, somebody say health, good health, make sure you stop at the Blue Cross and Blue Shield table. We also have Charles Drew, that's one of our really great partners, and they have a number of program services, the Healthy Start program, Men for Life, where they're focusing on the men. So make sure you stop at their table. Family Housing, who is in our building, we're in their building, but they have programs about credit scores, just a number of things, home ownership. So again, just be sure that you stop by their table. Peak Lotus, we have NOAA, North Omaha Area Health U-Turn, and then also Omaha Permaculture. So again, thank you for being here. If this is your first time, welcome, and I'm going to turn this over to Mr. Willie Barney, President and founder of the Empowerment Network.
All right, good morning, everyone. Oh, you can do better than that. Good morning. Today, it's going to be very fast-paced. We need all of our participants engaged as we go through it. It's a very important update on health in North Omaha. And we have leaders from all of the health systems, operations, organizations that are working in this particular area. I want to start right away. Commissioner Chris Rogers is here. He's been a champion of health for the entire time that we've been working together the last 13 years. He's going to give us a quick intro, and then we'll bring up Dr. Adi Poor, who is the health director for the entire county of Douglas County. But first of all, we always open in prayer. Pastor Hunter,
you did already.
All right, I'll open in prayer. Father God, we thank you for this time. We thank you for this day. We thank you for each and every person that's here. We pray that you will lead, guide, and direct our conversations today, that it will be productive and full of action and results. In your name we pray. Somebody say amen. Let's please welcome Commissioner Chris Rogers from Douglas County.
Good morning. Good morning. All right. Let me say, about to run out. Please forgive me. I'm juggling a couple of basketball games today with kids, but I needed to make sure that I was here with you all to set the tone for today. We've come to these meetings over the last couple of years, and the importance duly noted. We put on the jobs piece, the education piece, but I don't want any of you all to underestimate what today is, and you need to look at it and hopefully set it up in this tone. And what it is health in North Omaha. There's a name that some of you all here younger may not know, but you should remember this name. The older people here do know this name. It's a gentleman by the name of Frank Peake, late Frank Peake. I came onto the Board of Health with him, and he was always preaching mental health. And I couldn't quite get it when I first came on 12 years ago. And eventually, he brought the board there to where the board eventually started talking about behavioral health, then trauma-informed care. And then the board eventually made that point of trauma-informed care a priority for health in Douglas County. Dr. Poor, who's the director, is going to come up here and talk about some things that we found in what's called the Community Health Needs Assessment. This assessment has generously been paid for by the health systems here, and we're one of the few counties in the country where we have all the hospital systems on board to help us pay for it. What that health system, that health assessment does every 3 years, it assesses what the needs are in the county. And a glaring piece that we heard over the last couple of years has been mental health. Now, a lot of people may not know how to grasp it or put it in the right words, but that's the general piece of what it is. So since we did this about a year and a half ago, the staff at the health department, an organization called Wellbeing Partners, has been out meeting, and we specifically went in underrepresented areas to kind of get a feel and dig out exactly what that meant to them. Today, Dr. Poore is going to present that to you and give you an idea of what it teams up. But for you kids that are here with Step Up, you need to just kind of feel this a little bit, because I was in a meeting a few years ago, and this hasn't changed, with 11 superintendents from the Douglas County and the Sarpy County areas. And even though their number one concern is educating kids, they cannot stop talking about mental health. They cannot stop talking about the things that are coming into the classroom. And I say that to you all as you, because there are a lot of things that you are dealing with now, whether it's cyberbullying, all of these things like that are playing their way out. And you need to listen to this today, because there are outlets that you will hear from Charles Drew and community-based health centers that are in the schools. Maybe you need to just tone in on this and see where the avenues are at that you can have to relieve this pressure. So with that, there's a whole lot of other things, but what I want to do is make sure you connect the dots with this, because long after this, there's a term you need to be familiar with. And we need to do a better job of educating you with this, and it's called the social determinants of health. It's a big term that basically means health and all. 20% of your health care is a hospital, it's health insurance. The other 80% is where you live, where you work, what you eat, and your exercise. So to connect the dots to that, you're on a block. Your block doesn't have lights. Your block doesn't have sidewalks. You want to walk, you want to do certain things. That's the social determinant of health. Dilapidated housing is a social determinant of health. So the whole thing that my mother used to be said motherwit, where there used to be particularly for communities of color, because of the pressure of poverty and things of that sort, not having jobs, economics is a health issue. So with that, I want to set the tone for the presentations you have today. Make sure you play great importance to it and understand health is an underpinning of what we talk about here every month. So with that, I want to thank you for your time and look forward to talking to you.
Thank you, Chris. One more time, let's recognize the work of Commissioner Rogers. We're going to move right through this. Step up. Step up, students. I need you to stand up real quick. All the folks here from Step Up, stand up. Let's recognize all of our youth that are here. I want to make sure, as Commissioner Rogers, you can have a seat. As Commissioner Rogers said, your voice is extremely important. And you're about ready to hear an example of why it's so important. What you said last year, the number one priority that you said in this meeting was mental health, and Chris just talked about it. We have with us Dr. Ani Poore. Dr. Poore is over the health department. She's the health director for the entire county of Douglas County. She's here to give us an update and report back on what's happened since this last meeting that you provided input. Let's please welcome Dr. Ani Poore.
Thank you. I'm really excited to look out and see all these young faces. I don't have a lot of opportunities to do it to a crowd like this. So welcome all. And as Billy said, we have worked with the Empowerment Network for the last 10 years. And what we have heard very clearly in this room a year ago is mental health. And what I want to share with you that we are really listening. And the last year, what have we done to listen to what you have told us? We have done several surveys, as you can imagine, all over. We have done phone surveys, we have done systems assessments, community strength and themes assessment. We have asked 3 questions, very specific. What do you love about your community? What keeps you up at night? What is your hope for the next generation? So I want to give you this background so that you know this is not, I'm pulling this not out of the air, but we are engaging the community and we want and need to hear from you. Your voice matters to us. So when we did the community needs assessment, there were 10 priorities or opportunities that came up. And that was a phone survey where we asked all Douglas County residents, what is your health status? It's all numbers. But at the end, these are the 10 issues where we would see we are worse off than the nation. We can improve and we need to improve. But where are we going to start? So we had several meetings where we started to talk to organizations and say, from those 10 issues, tell us what are the highest priorities. They came up with a total of 5 priorities. I said, 5? That's still a lot of priorities for a community. So then we came, and I came to you also, and we said, tell us the number 1 and number 2 issue that you see. Heard very clear, mental health was the number 1 issue. We went back into the community and had community meetings, some in North Omaha, some in South Omaha, and we said, okay, so now tell us, you said mental health, but what do you really mean by mental health? And this is some of the array that we heard. Stress, anxiety, socioeconomic status, addiction, trauma, lack of social support. So we brought all these things together and said, what are the roadblocks to assessing the mental health care you need? Some of them said, well, healthcare providers don't look like me. I'm not trusted. I don't even know where to go. I don't even know how to start. After 2 more rounds of meetings, there were 3 themes that came up over and over again. These 3 themes that we really want to focus on as a region, not only as Douglas County, but we got Selby County involved and part of Ottawa County involved too, because when we do these needs assessments, we have all those topics around the table. And I tell you, if we have a regional priority, we probably can put more resources toward it, we hopefully can make an effect. So the 3 issues that came up very clearly were stigma. There's a stigma around mental health. I'm not comfortable to talk about mental health. I'm not comfortable to tell you that today I have a mental health day. I'm comfortable to tell you, today my tummy doesn't feel well, but I'm not comfortable to say I'm stressed today. I can't go to work. So stigma was really one. The other thing that we heard is loneliness and isolation. A lot of people would say, we don't even know our neighbors. I feel cooped up in my house. I don't have any place to go. I don't know who the people are. Nobody cares about me. I'm on the cell phone all day. I listen on social media where people go on vacation or what they do. But that isn't the touch. That isn't the contact that I need. I don't have a grandma who looks out for me. I don't have family members around. So that social isolation became very clear as an issue. And then the last thing was people said, we probably have resources in our community, but I don't know what the resources are. I wouldn't even know how to access them. So those 3 things in mental health, the Douglas County Health Department and the Health Department in general, they're not so much about beds and about clinical access. We are more trying to see what can we do beforehand. So potentially we do not need more beds. Potentially we do not need to have more investments in clinical services. From that, the three, of course you can imagine, the three areas were an anti-stigma campaign. People said we need to start talking about it. An anti-stigma campaign is going to help us. They talked about young people. They said, what about residence dinner? What about dinners where we socialize and start talking about mental health? They talked about creative expression as a way of really normalizing mental health. Closer. And they talked about advanced directives for mental health. This sounds strange. So really all this says, what are you measuring and what are your goals and what are you trying to achieve? So we asked the group the same one, and the primary goal was to reduce mental health stigma by 10%, metro-wide. So that's the goal. We all are working on, all in here, all the health systems, from mayor to the governor to every spokesperson in this community. We need to start talking about mental health. Only then can we make a change. It starts with you. It starts with you. I want you to have these discussions when you have lunch breaks. Talk about it. Talk to your friends and say, I don't feel well. The other that we heard, we want to increase connections to resources. We want to build more integrated care services. In workplaces, we even want to talk about mental health. We want to create advanced directives, and 211 is a service that United Way has where people can call in if they have questions about resources in the community. So they thought that would be a really good way. Decrease social isolation. Again, we want to have more of these dinners in our community. We want to increase volunteerism, and United Way is really at the front of that. I want to give a shout out in your area. Some of you may know that an award was given to an area in 68111 zip code, the intergenerational campus. To really start talking about, as a campus, on the community level, what do we need to increase mental health? And it's all community driven. It's not driven by somebody who sits in an Eiffel Tower. And the last one is addressing trauma. We have a Trauma Matters Omaha, which is a website and an effort that's going on at this time. So we really want to make that conversation established in all of the businesses. And you will hear later on of an action report in regards to the ACAs, the adverse childhood events, which we all know underlie many of these. I want to close with this, because you have always heard me talk about health issues, cardiovascular disease, cancer, and so on. We have made some progress, but the progress is little. And I had to say myself, after I have been here last year, I am wondering if we are missing a missing link. The link is mental health, who is in the middle and connected to all the different health issues. And then on the outside, you have the social determinants of health that also affect all of this, as Commissioner Rogers has just talked about. So keep this in mind when you are moving forward with the community and in your circles. So this is all I have.
Thank you, Dr. Poore. Recognize Dr. Poore. Can you go back that one slide? Dr. Poore, you may have a couple quick questions, and then Kenny McMorris, CEO of Charles Jewell, will be up next. This slide is kind of the summary of where we are right now. All of this has been said from the previous two speakers of how this all connects back to our mental health and how we feel about ourselves, how we feel about our families and community. We'll maybe take a couple quick questions right now
and then we'll come back. And again, we have some very quick presentations. We'll have to do a panel with some of our health system leaders, and then you'll have more interactive conversations at tables like we always do. So if we can keep the questions very tight, and then we can move it through.
Yes, this is Dr. Morris. We've been following the statistical data of the Department Network for the last 13 years. As you stated, the majority of this data is repetitious. It says the same thing. If the mental health situation is identified, and first thing you're looking at the children, even looking at the 13-year span of time that we've been looking at the data, we're still not dealing with the foundation of the structure which you identified in. It is the family structure, i.e. programs like the DMC that deals with the youth that are incarcerated. One of the things that they identified was that a lot of the kids are recidivating back into the system because they get treated better at the county than they do at home. That is a mental health situation that we don't have time to research and try to find answers for when we've been stating the basic problems: lack of services, lack of revenue disseminated to it, and these other kind of situations. So this becomes very redundant after a period of time.
I got to answer you.
He's going.
Okay. To your point, that dot's been connected over the last year. Kenny will probably get into a little bit of it. So he mentioned, he tied this to the youth center. So there are, and the numbers we've seen, increasing number of youth that come in and they're on some type of psychotropic medicine. And the issue is that kids coming through the court are coming through with some issues. What we've done last year is pretty much tied together with Shaw's group programming that the partners are CHI, UNMC, Nebraska Medicine, Creighton University, and Charles Drew. The connection comes, that kid comes in, they now have a medical team there that has started to go there, they go through the evaluations. Because of a lack of coordination before, that kid had to sit there until we found some way to get them managed out in the community. Now, the eval happens, Charles Drew is at the table, that kid is out while they're waiting to go through the system. They're managed at Drew. It hasn't ramped up totally, but they have been ramping it up big, and the result is being seen today to some degree. As of the number I saw this morning, probably from about 3 weeks ago, that number fluctuates. The number in the youth center was somewhere around 89. Today, that number is 65 this morning. So that means basically there's probably about 35 kids that have created some offense that need to be there, and so that number continues to be there. So the programming that we're doing is connecting the dots. So that connects the dots in respects to kids sitting there with mental health, kids being out, and now they'll get managed in the community by Drew.
What about the county jail?
That's a whole other deal, which we are working through.
That's the parents.
Well, no, the county jail is adults.
The
county jail is
the adults are the parents. The adults are the parents.
The county jail is adults.
Right. What about them?
Well, that is a conversation where you need to have me join that with some state senators, because the issue is that county jails across the country are becoming the de facto mental health centers because there's not sufficient mental health care in the community. The jail is becoming a safety.
So with that statement, what are you saying that the community should do? You don't never want to answer no questions.
So my question is, so with all the evidence surrounding the factors that contribute to mental health, is there any legislation being developed around putting culturally appropriate licensed mental health professionals in every school and then making it mandatory, making a mandatory wellness check for every student at least once a year?
I'll let Kenny answer that, because there are community health centers in each of the schools with community-based health centers, so I'll let him go there.
All right, good morning, everyone. Good morning, young people. It's good to to see you all. You all are our future. We're talking about healthcare, but a lot of the things that have been put in place is really to set a foundation for what it means to be healthy, what it means to have an overall health and wellness plan. And so I'm here today representing Charles Drew Health Center. Just by way of context, we have 12 service delivery sites, 200 employees. We have 4 school-based health centers, 4 centers in the Omaha Housing Authority Towers. We provide care to individuals that are experiencing homelessness as well. So I have a few people as part of our team here. Dr. Derek Anderson, I'm going to raise your hand. He's one of our family practice physicians. Larry Duncan is our Senior Director of Behavioral Health Services, so he's leading our charge there. And then we have Edna over here at the table in terms of community support services. So again, we exist to serve the community. Some of the questions that Commissioner Rogers is speaking to is really looking at how are we connecting the dots. We've always known that North Omaha and even South Omaha to a certain extent have been plagued with some of the worst health disparities that you'll find across the country. The thing is that what are the solutions to address these issues? And so Charles Drew has stayed in that space. We've stayed in that gap. We've been here since 1983. And we're part of a bigger movement that is called Community Health Centers or Federally Qualified Health Centers. So under the leadership of our current board, and we have a few board members here as well, we've been very clear that healthcare is right. And so our job is to make sure that we help work with our partners, the health systems, to keep this community healthy. So this slide here is kind of a busy slide, but these are all the services that we provide. Our primary goal is to develop health maintenance and health prevention plans to keep people out of the hospitals. Commissioner Rogers mentioned social determinants of health, social drivers of health, and all of those factors that impact individual health-seeking behavior. We are here to help educate everyone in this community on how to navigate the healthcare delivery system. It's very complex. We live in this world every day, and it's still difficult for us in terms of how we get through things. And so, with that being the case, Charles Drew is here to serve this community. We do medical, dental, and behavioral health services. That's all part of our entire clinical enterprise. Over the last few years, and as Dr. Core mentioned, access is a big part of that. Well, access to us goes beyond just having a location. And so how are we meeting people where they are? So a big part of the charge is providing services and doing mental and behavioral health in schools. Actually sending therapists to be of service to the administrators and young people in schools. And so we do have 4 school-based health centers, one at Northwest High School, King Science Middle School, Kellogg Elementary School, and one at Belvedere. However, we do have therapists that actually make it to other schools based on need and support that you all need within the schools. So that's our attempt to try to do everything we can to make sure that you all have access to healthcare, family has that access to healthcare, and behavioral health serving as one of those ways in which we do that. So you can see as an organization, we've grown. This is the total number of patients that have accessed our system over the last few years. So this is letting us know that more people are becoming aware of the services, that more folks are becoming more educated about how do I get and where do I go to get services. And again, we're proud of that, Charles Drew Health Center, that we're filling in that gap. This slide here represents the service lines. So this far left corner is where we've grown medically. The middle is where we've grown from a dental and oral health care standpoint. And then the final piece is behavioral health. And so, as was mentioned before, we know that mental health and behavioral health is a big area, a big aspect of everyone's overall health and well-being. These numbers show you that Charles Drew is doing everything we can to help support this community. So that's why it's more imperative and important that the systems are working together. One of the things that we know is that it's just very fragmented. We know a lot of our families are seeking health care episodically, and we have to do a better job of creating health care homes for this community. And so we want to be one of those places for you all to choose as a health care home. And obviously some of our system partners will be speaking to that. So this again speaks to the growth and kind of where we're going as a health system. These are our primary zip codes. About 2/3 of our total patients come from 5 zip codes. 68111, 110, and 104 are the areas in which we predominantly provide care. All of our sites are either east of 72nd, north of Dodge. So we're right exactly where the community is. So again, this slide kind of shows and indicates the areas where we've grown, but more importantly, it shows where the opportunities are. And so we have to do a better job as a community of making sure that you all understand where services are available and how to access those services.
Can everybody hear me? I want to do a quick check here. Normally we have polling that we do
but I want to do it interactively. How many people live in North Omaha? Raise your hand real quick. Raise your hand high so we can see. All right. You know what zip code you live in? Okay, I'm gonna do this real quick. 68111. If you live in that zip code, raise your hand up real quick. 68111. All right. 68110. 68104. Okay. Just want to see how real and connected everything is. Go ahead, Kenny.
All right, so the final piece is Medicaid expansion. Just want to do a quick overview on this. So health insurance in and of itself doesn't necessarily mean that you're going to be healthy, but it is a great driver of how people and outcomes become available for folks. And so through a referendum, the vote of the people in 2008, we decided to expand Medicaid as a state for individuals up to 138% of the federal poverty level. That number is significant because when you look at the community in our 3 primary zip codes, there's about 9,000, based on some of the research I've seen, about 9,000 individuals that are uninsured that reside in those 3 primary zip codes. And so now they will have an opportunity to have at least a health insurance payer to help further their health. The plan or the way that Medicaid is set up, 90% is funded by the federal government, 10% funded by the state. And our state has decided to go through what they call a 2-tiered system. So there'll be a basic plan and a prime plan. The basic plan will provide comprehensive medical, behavioral health, and some prescription medications for individuals that decide to enroll in the program. And then the prime plan will provide dental, vision, and over-the-counter medications. Now, everyone that decides if they're eligible for the basic plan will have about a 6-month waiting period where they're going to have to demonstrate what is being called wellness and personal responsibility requirements. Those things will include job seeking, volunteering, identifying a primary care doctor, making sure that that you attend those visits. And so if you meet those requirements within a 6-month period, then you will have an opportunity to bump up to the prime plan, which will then give you access to rural health care. Now, as we look at this, anything that will create barriers to access to health insurance, from our perspective, we can do better as a community. And so I'll be the first to tell you that while this is great for this community, this is not ideal. It's not an ideal system. And there are going to be some things that we're going to be advocating and working for to make sure that anything that creates a barrier to individuals accessing health insurance, we're going to try to eliminate. So just know that Charles Drew and our leadership and members of this community, we are going to continue to keep advocating and fighting to make sure that some of these barriers can be removed if possible. The other added aspect of this is that the plan, even though we voted back in 2018, the plan will not be implemented until October. But we're being told that open enrollment will probably start somewhere around August, but we're almost 2 years in now to this point from when it was voted in that we've actually going to start rolling this. And so there will be more to come in the community. One of the ways that we are looking to try to address this is making sure that we have staff on the ground, boots on the ground, community health workers, individuals that can help educate the population about what does it mean to have health care, and what type of services are you going to be eligible for when enrolling in this plan. So again, the reason why this is significant for this community is that we're looking at about 9,000 individuals that are uninsured in those 3 zip codes, 68111, 110, 114. That's not even including the ones that are underinsured. So that's a whole another area there. But this is an opportunity for this community, for this state, to further our healthcare initiative. So again, thank you all for your time this morning. As I said before, we've been here, we will continue to be here. So much of the work is about people, building relationships. Can I trust you? Do you make me feel safe? And the clinicians and the staff that we have at Charles Health Center are there to do that every day. So thanks everybody.
All right, thank you, Kenny. And I know you'll be available for questions as well. Kenny mentioned 2 things. How many people in these zip codes do not have insurance?
9,000.
All right. And when we surveyed this room last year, 20% of the people in the room said that their family did not have insurance. So though we have these high quality services and healthcare, 20% didn't have insurance and can't access that. So that's one of the things and one of the reasons why we're here. Elijah has raised the issue around juvenile justice and the county health department. the jail. And that's been an ongoing conversation about we don't have enough mental health services available for those that have been involved or trying to keep them out of the system or when they're coming back out of the system. So what are the things that we're going to do collectively to address them? That's part of what we're moving forward on today. Again, we'll have more opportunity. I want to make sure everybody has the overview agenda because it has important information on it. Raise your hand if you don't have the overview agenda that has everything for today. Raise your hand and we'll make sure copies come around. Okay, it looks like quite a few people need that because that's the base. A part of the reason why we have youth and adults here, you have to be the champion for this. You have to take this beyond your seat, take it home, talk to your church, talk to your neighbors, pass this around, make sure people know what services are available in our community right now. There are gaps, but let's make sure that we're connected with the resources that are out there right now. That's part of what we're doing. Thank you for answering the question. All right, so next up is, what are we doing about this collectively? We've had these meetings. One of the things we did about 5 years ago or so is we partnered with CHI Health. They were making some transitions with their hospital, and there was a big uproar in the community about what's going to happen. How are they going to continue to meet the needs of the North Omaha community as they're transitioning to Bergen? Todd was a part of those meetings and helping to identify what are the gaps, what are the most important pressing health needs in North Omaha. He's coming back to give us an update on what's happening at the 24th and Cummings Center. Let's welcome Todd DeFries from CHI Health.
So, as Willie was mentioning, it was about 5 years ago we actually sat in this room and discussed what are the services really needed in North Omaha and East Omaha as it relates to the hospital moving out to 75th University. You can see we actually have a building there now versus when it was still a strip mall at the time. So as we sat here and worked through this discussion, really what came out of that was the community saw three things that would be access to primary care, particularly a patient-centered medical home, access to specialty care, and then access to emergency care. So as we went through that discussion, at the same time we were having discussions with Creighton University around the need for interprofessional care and collaborative practice, and I'll get to more about that in just a second. So the services we provide now at 24th and Cumming are cardiology, diagnostic imaging, the emergency department, endocrinology, family medicine with the patient-centered medical home, internal medicine, neurology, OB/GYN, occupational therapy, children's physicians has a clinic on site, Creighton University has a retail pharmacy, and then physical therapy and speech therapy. So getting to the IPEC, this is really where we've been able to really revolutionize the way we're providing care in a clinic-based environment. So we're really focused on a team and team-based care and how we can allow our members back to the top of whatever profession they're in and move in and out and take care of patients together as a group. And so this clinical team is part of our patient-centered medical home, and we added resources like occupational and physical therapy and our community program, which is really focused on the social determinants of health. And then we use HUBs, advanced care planning, to facilitate teamwork among that entire group so they can come together and plan for the individual care of each patient that we see. So you can see the whole list of all the various people that are part of that interprofessional team there on the right. The one that we just added and is actually really exciting, and we're looking to see kind of what the data shows us in terms of how it impacts care, is pastoral care. As we went along, we noticed that we were really focused on physical and behavioral health, but the piece that was often lacking was really attending to some of the spiritual health. And so having that resource on site, being able to attend not only to our patients, but also to our employees, has really been impactful. In 2016, we received a $100,000 matching grant to facilitate that IPE and team-based care work. Where we focused was how can we reduce ED visits, hospitalizations, and hemoglobin A1C, and really focus on how can we reduce the cost of care for all the patients that we see. and just using a care planning model, using training to facilitate that team-based model, focused not only on interconnectedness and on conflict management, but also on how can we create teams that understand the patient need, that understand exactly what it is that each patient that walks through our door has in different circumstances. So the results of all that, just to jump quickly, I know I'm already running out of time. So we saw an overall reduction of 37.57% in ED visits. We saw a 42% reduction in hospital admissions, an 8% reduction in hemoglobin A1C, and about a $4.2 million reduction in charges for those patients that were a part of the group. So this is 2017. You can see we're still out. We're trying to get published the data from 2018 and now for 2019. But both for 2018 and 2019, we've seen continued reductions in pretty much all of those measures. And so really focused on not focused on treating illness, focused on keeping people well. Just to kind of show, our emergency department has continued to increase in volume. This is the slide that I don't really like to show because really what we want is to move people out of the emergency department and into primary care. And as Penny showed, very similar to the service area that Charles Drew has in terms of the patients that we see. These are census tracts and not zip codes. But then getting to the point that Commissioner Rogers said about the social determinants of health and how we're, CHI and 24th Street Clinic are really focused on taking care of people, not only the physical, mental, and behavioral health, but also how can we partner with community nonprofits and leaders to impact the rest of healthcare. So 20% of healthcare is, or your health is provided in healthcare. The other 80% is out there in the community. So Dr. Kaur mentioned the community health needs assessment, and this slide kind of shows how all of our hospitals here in the metro are looking to advance our implementation strategies for the community health needs assessment. So our major focuses are behavioral health, injury and violence prevention, and then the social determinants of health. And two main programs that we're really focused on at the 24th Street location are first Community Link, and so that's a grant-funded program that's really designed to focus on identifying the social needs of our patients and then support them in accessing resources wherever they are in the community. So examples would be food insecurity, utility assistance, transportation needs, and medical coverage. So we have a team of members that actually assist patients in applying for Medicare and Medicaid and utility assistance. And so they have the knowledge to connect people to the right place at the right time in order to make sure that their needs are being met. So in 2019, we saw over 700 patients and made more than 500 referrals to community resources. The other program that we have that just finished its second pilot is a partnership with Together that looks at better taking care of the needs of our homeless patients. And so the service we provide are financial resources to find and maintain housing, case management services, and then resources to stop the housing crisis and attain sustainability. So basically the main referrals that we've had, of the 34 that needed follow-up and intervention, we spent $12,000 on 13 patients. So only about a third actually needed material resources. The average spend was $923 and the median spend was $900. And so with that, we're paying for apartment applications, permanent housing, and then paying utilities, moving costs for eviction balances so that people can stay in their home.
All right, thank you, Todd. Let's recognize Todd. Caprice, before he goes, real quickly, where is the location? What's this location? What's the address? Where? Anybody? Who said it? 24th and Coming. Let's say it together. 24th and Coming. All right, that's where one of the locations is for CHI Health. Again, I want to make sure everybody has this sheet because I want you to take this home with you. This has a map of all the different locations that you're hearing from today. And then on the back, we actually have the names of those leaders of those organizations. So two things we want to do real quickly, and then we want to get into our interactive conversation. For the first time, we have representatives from almost all of the health systems, major health systems. We have Dr. Jim Linder, who's here from Nebraska Medicine, and we have Dr. Rodrigo Lopez, who's here from Children's Hospital. They have been working with us in different ways over the years, but this is the first time we've had an opportunity to reach out to the leaders of those specific organizations, and we want to give them a chance just to give a quick preview of some of the work they're doing in North Omaha, and then we're going to have a quick Q&A with them along with some of the other leaders about where do we go from here to address some of the issues Elijah has brought up and also get a few other questions from the room. So with that, I'd like to bring up Dr. Jim Linder, who is the CEO of Nebraska Medicine. Sorry, President, right? All right, let's welcome him, Nebraska Medicine.
Thank you, Mr. Perry. Barney, I'm sorry. Excuse me. It's really a pleasure to be here today and look out at all of the people in the audience because it shows that you are taking ownership of this. And I just want to make really three quick points. A community owns their destiny, and people own their own personal destiny. And that's the only way any of us prosper and survive. So it's just heartwarming to see everyone here gathering information and working toward making the community better and stronger. And Nebraska Medicine feels to be part of that community since we are the only acute care hospital east of 72nd Street. We have clinics here in North Omaha in conjunction with Girls Inc. and with our Fontenelle Clinic, and then we work with Charles Drew as well. And our emergency department, like it or not, is the busiest in the state. We have 95,000 ED visits a year. And many of those ED visits come from individuals who are challenged by the issues we heard about this morning. The social determinants of health, the behavioral issues, and the things that cause people to require a visit to the emergency room. And it's much preferable if that doesn't happen. Now, one of the truths of hospitals and health systems is they're really spend most of their existence taking care of people who are sick and not trying to keep communities well. So one of the real challenges that we have as a health system, whether it's Methodist Children, CHI, or Nebraska Medicine in this community, is changing our mindset and working closer with the communities to keep people healthy. And historically, no one pays for that. And the importance of Medicaid expansion is that funds will become available to provide those services so the communities stay healthy. Now, a key part of health is having a great job. And I'm really delighted to be here at North High School because it's a STEM magnet school. And at UNMC in Nebraska Medicine, we love STEM, okay? Science, technology, engineering, and math. Because really that's the basis of so many of the healthcare professions. We have active outreach to the hospital, to the high schools, Metro, and other programs to make sure we can assure that all the young people, with these folks right in front of me here, all of you out there, realize that if it's something you are interested in, you can have a great job in healthcare. And with that, I just express my gratitude for being with you today, and we'll answer any questions that come up in the panel. So remember, we own this, it's our community. 2, be your best if you're one of the young people in the room, because you do represent the next generation, and make sure you have the education to have a great job. Thank you.
Thank you. Thank you very much, Dr. Linder. And we'd next like to bring up Dr. Rodrigo Lopez from Children's Hospital to give us a couple minutes about the work that's going on with children. Let's please welcome Dr. Rodrigo.
Well, let me clear one thing. I'm not a medical doctor. I don't have a PhD. I hang around many that do or have both of those. So just Rodrigo. So let me very briefly tell you about the mission of Children's Hospital. We exist to improve the life of every child, and we do it through 4 elements. Clinical care, and I think all of you know that we do that. We've got a big hospital where we deliver pediatric medicine. But we also educate medical students. We do research. And more important for what we're talking about today, we do advocacy for children, for the health of children. We do that through collaboration with a lot of different institutions. Nebraska Medicine being one of our partners in a lot of things that we do. And we have a unique characteristic that is, we're fortunate in Omaha to have a children's hospital that is independent and that has a strong academic relationship with the University of Nebraska Medical Center. That allows us to collaborate with a lot of institutions, schools, and agencies throughout our community and our region. One of those elements that we have within our organization that are really critical for what we're trying to do with communities like North Omaha is the Center for the Child and the Community. Up until now, it has been Lincoln-centric. We have moved that to Omaha to specifically address the issues that are being discussed today. And going forward, we're going to make sure that we enter into much greater collaborative initiatives, not only with Charles Drew, and we're going to be scheduling a meeting with Kenny McMorris in the near future, and we'll be doing the same thing with One World in South Omaha. But we want to improve health outcomes. Dr. Glitter talked about environmental cause illnesses. We are going to have to take care of kids that have congenital diseases. Those will end up in our hospital. We have a lot of rooms filled today with those patients. But we should not have to take care of kids that end up in our hospital with environmentally caused diseases or illnesses. We have to address the root cause, and that is what we're talking about. And we hope that through that collaboration with a lot of the groups that are working in your community, we can not only improve the health outcomes, but also we can improve the achievement gap. That one of the reasons for that are health, and we're going to try to work with you. So we'll be glad to answer more questions during the panel. Thank you very much.